put the three IT people next to each other. Put Navarro? Navarro? The most American way of pronouncing it? Is that terrible? I'm sorry. No, I promise. I've been practicing. As I said, I'm gonna let you guys all introduce yourselves first, so I don't butcher it. Okay. All right. You guys ready? Good. Good. All right. Good afternoon, everyone. We were giving people a couple minutes to join, but we'll let them come in because I think three of our panelists are actually speaking on another panel across the way right after this. So I want to make sure we respect time. As way of introduction, my name is Bethany Larkin. I wear two different hats. The first one that you'll see in the program is I'm a manager at a startup based in the US called 1110 Innovation Partners. We focus on building strong ecosystems between life science companies, healthcare organizations, and academia to make healthcare work like it should. Today, I'm here as part of Emory's program called AHIA, or Advancing Healthcare Innovation in Africa, where we look to build strategic partnerships in order to create a better enabling environment for innovation to thrive. And ironically, that is exactly what our panelists today are going to be speaking about. The topic is exploring strategic support mechanisms to support innovation and entrepreneurship across the continent. So with that, I'm going to give a little structure to what we're going to do today, and then I will turn it over to the people you're here to hear from. So first of all, when we kind of think about this topic of exploring strategic support mechanisms, the way that I kind of think about this is this morning we heard about venture capital. We then heard from entrepreneurs themselves. But in order for entrepreneurship and innovation to thrive, you have to have a good enabling environment for all of that innovation to actually take off. And so those that are sitting on our panel today represent that enabling environment, from intellectual property to commercialization to all sorts of things from East Africa. I think you guys cover a number of different things, including venture. And so we want to kind of focus on those key areas today of how do the support mechanisms here really help innovation thrive. So with that, I'm going to turn it over and allow everyone to introduce themselves. We'll spend about 1 to 2 minutes with introductions each. And then we'll come back with a key question that I've asked each one of them to focus on. And time depending, we'll then do one more question and a round of Q&A. So with that, I will turn it over to our first panelist here.
Oh, thank you so much. My name is Brian Pahlele. I come from the Technology Innovation Agency. We are a technology development finance house set up by Statute of Parliament. In terms of personal responsibilities, I'm responsible for the natural resources investments, energy, ICT, and advanced manufacturing. By way of professional background, my technical training was in the science, molecular and science biology. I studied law, and I did full investment lifecycle management. From an experience standpoint, I sort of had luck commercializing a number of technologies in the manufacturing sector, information security, minerals processing, nuclear medicine, and pharmaceuticals. Now, in my current role at TIA, we as I say, we are a funder. We deliberately look for high risk technologies which are not mature commercially. Thank you.
Good afternoon. My name is Wamboi Gashiengo Nyabero. I am from Vilgro Africa, that is based in Nairobi, Kenya. We are an incubator and impact investor, and we support startups that are in their early stage to growth. And we support them with both technical support as well as with typically grant financing, but also, depending on the startup, sometimes we'll take an equity stake. My background is in engineering. I am a medical device engineer. I have experience in the medical device industry, many years in North America, and just relocated back to Kenya, and very, very excited to be part of growing the medical device industry in Eastern Africa, but also throughout the rest of Africa.
Hi, everyone. My name is Suvina Singh. I'm the Director of Intellectual Property and Commercialization at the University of KwaZulu-Natal. So this is my hometown. Whoop, whoop. So yeah, I'm really excited to be here today. My background is in intellectual property. I'm an attorney, and I also do have a background in the National System of Innovation. So at Incubate, the innovation office, we have three portfolios. We have a technology transfer portfolio, a consultancy portfolio, and also a student entrepreneurship portfolio. So hopefully I'll be able to relay that perspective through to you today. Thanks.
Good afternoon, ladies and gentlemen. My name is Ngabakazi Galada. I'm from Innovus at Stellenbosch University. My role is a tech transfer manager, where we support researchers, innovators, entrepreneurs with intellectual property, startup companies, licensing, and industry engagement. Before I joined Stellenbosch University, I was with my neighbor here at Walter Sisulu University. But before that, I was with the Department of Science and Innovation. I was one of the forerunners for our inaugural BioAfrica, so I was running on the floor, and it's really an honor today to be sharing a stage with great panelists. I also hope that I'll be able to contribute to the discussion. Thank you.
Good afternoon, ladies and gentlemen. I hope you're not having IDs. After lunch, people tend to, yeah. So my name is Pumele Nkomo. I'm the Technology Transfer Manager at Walter Sisulu University. There seems to be a lot of lawyers here. So I have a life sciences background and also IP law firm experience. So of relevance today, particularly for this talk, I think I'll deal with IP support. Yep.
All right, fantastic. Keeping a timer up here, and y'all did great, so thank you. So we're going to turn to some actual content here. So the one main question I want to start with and pose is, again, we're kind of zooming out and talking not just about entrepreneurs, but what is the enabling environment to help entrepreneurship thrive. So each one of you represents, well, the three lawyers are at the end here, but each one of you represents a different enabling partner in order to support innovation. So can you, in kind of representing your organization and the work that you do, talk about how your organization plays a role in being an enabling partner for innovation?
Right. I think from our perspective as a technology innovation agency, the financial leg of our mandate is self-explanatory. You come to us with an innovation. If we like it, we give you money. That part is self-explanatory. The non-financial requires some illumination. We find that both in the private and in the public sector, the innovators that approach us have a particular challenge. And this challenge relates to describing the business model underpinning their innovation properly. And when they're not able to do that, that's when we end up not liking what they are telling us. But we realize that there's an increasing demand for us to bring to bear to our proximity with industry for the benefit of these entrepreneurs and these innovators. And I will use one example. Most recently, we looked at a technology which happened to be of nuclear origin. This technology had all the desired isotopic properties that one would want in relation to its function. The technology was really about obviating downtime for the mining industry. However, the innovators didn't really know much about the mining industry. So therefore, their ability to fully describe the business model was curtailed. And it was going to be borderline reckless of us as a development financier to turn very good proposal simply because the packaging is poor. We need to make that distinction. And when we realize that we're dealing with a small matter of poor packaging on something that looks very good, we have to step in. What did we do? We looked at this innovation in the context of the entire enabling ecosystem. We looked at what needs to be in place for us to do justice in crafting the business model. So we're able to bring companies that the innovators had no access to. These companies have a footprint in the industry of choice, and these companies know quite a lot of things that the innovators had no knowledge of. I'm talking about people that distribute original equipments on the continent on behalf of large multinationals. So they were able to pinpoint the intricacies that ought to be addressed in solving that particular problem. We went on further to bring people that have got critical distribution and logistics capabilities for products of nuclear origin. And we were able to also bring guys that often will develop mines and do O&M for the mining industry. When we assemble that kind of brain power around the table, our ability to translate that innovation into a viable business solution shot up. So in a nutshell, I'm answering you through a story that our non-financial support is where we bring to bear our expertise. We use our proximity to industry as a funder to the benefit of these high-value opportunities. Let me pack it there for now. Thank you.
Yeah, I think that was great. I heard, ideas around the non-financial support, the business models, especially around access as well. I think you started your story talking about the fact that the innovators couldn't necessarily or properly define their innovation or business plan, which I think is a perfect segue. So we'll hop over to you and talk a little bit about incubation in Kenya.
Thank you, Bethany. So yes, very similarly, we do provide some funding for startups. But I think I was telling someone a little bit earlier that I think that the greater value that we add to entrepreneurs and to startups is that technical assistance. And so we have a very structured methodology that we use to support startups. We work predominantly in the healthcare solutions space. Personally, I support people who are developing medical devices, but in general, Vilgro Africa is working in the healthcare solutions space and providing that very structured methodology to get them to a place where they can go in front of investors and get follow-on funding. So how we do that is very similarly to what you just talked about. When we get a startup in and we like what they're talking about, we do something that we call a diagnostic panel. And what that is that we bring people in from industry and experts, people who have expertise that maybe we don't have internally. We sit together and we spend some time digging into the startup's business model, their technology, and whatever else it is that they are talking about. And we figure out what is the best way forward. What kind of expertise maybe do they not have that they need to get? What kind of resources do they need? And we create a plan for their development from wherever they are to the point wherever it is that they need to be, say in the first year or 2 years, whether that is mostly technology development, whether that is access to markets, whether that is business model, or all of the above. And so once we have those kind of structures around this is what we're going to be working on, then we bring resources to bear to help that process. And then we have a series of milestones that they work with a coach to sort of bring the resources together, bring the plan together, and just march towards what it is they need to be doing. So that's the Vilgro process, and it's worked very well. It's added a lot of value to a lot of our startups, some of whom you can actually see in the exhibition hall. Just to take a kind of a sideways step, because part of what we're supporting is medical devices, and as a Chief Technology Officer at Vilgro Africa, that's my mandate, is to support medical device development companies. And what we do there, just because there's a lot more of the regulatory burden for medical devices, is really help them also to understand not just the technology and the business, but also all the regulatory, legal, all of that stuff around medical devices that they have to understand to either be approved locally or internationally as a medical device. I think I'll stop there to give my colleagues time to weigh in. Yeah.
Yes, thank you for that response, and I really like the idea of the diagnostic panel of identifying where the gaps are for the innovator and then kind of honing in on those key areas to ensure that they can move forward. And I also appreciate that because it set me up well. You ended talking about regulatory environments, which I think is a nice segue into our three remaining panelists that focus on the intellectual property space. So we will kind of walk through each of your different perspectives, and then we'll come back full circle with another question.
Thanks, Bethany. So I sat here strategically, so I didn't go first and it didn't go last. Definitely not. That's well planned. So yeah, I mean, like my co-panelists, as the Innovation Center at UKZN, we definitely do a lot of what they have already mentioned. Unfortunately, unlike Brian, we don't have money, so there's no financial support, which I will get to, but definitely a lot of non-financial support and definitely a lot of technical assistance. So just to preface what I'm going to describe to you in terms of the drivers, in terms of creating an enabling environment at UKZN, just to expand a little bit on my introduction in terms of what we do as the Innovation Center at UKZN. So I mentioned that we have three portfolios: the technology transfer portfolio, then the consultancy and student entrepreneurship portfolio. So in terms of the technology transfer, this is essentially where we are working with our academics at the university to look at the intellectual property that they have generated and look at how, if possible, we can commercialize this through licenses or spin-off companies, as my colleague had mentioned. Then in terms of the student entrepreneurship portfolio, that's where we're working with our students that are interested in starting up businesses whilst they're at universities. Ultimately, we would want them to link it up to what they're studying under their degrees. And yeah, basically just work with them to give that support to them to get the businesses going, introduce them to the concepts of entrepreneurship, and just providing that mentorship and coaching whilst they're at university to get those businesses up and running. And then in the consultancy portfolio here, we're trying to link up our academics with government and with the private sector to look at consulting opportunities to ensure that, that they're always staying at the edge of what's taking place in the external environment and bringing that internal to the university. So with that broad framework, just to talk about what I've identified as some of the main drivers in terms of creating that enabling environment to support bio-entrepreneurship or entrepreneurship in general, really. The first, in terms of the regulatory environment, as we just mentioned, what is key that we found is a critical piece of regulatory documentation is the IP policy at the university, and I think that's what a lot of our universities in South Africa have developed under the Intellectual Property Rights from Publicly Funded Research and Development Act, or the IPR Act. And this is such a critical document at the university because it provides that guideline for all the players that are interested in getting their IP commercialized to say, these are the set of rules that we're all playing by. whilst not everybody might like the rules, at least the rules are there for everybody to see, right? So in terms of the IP policy, some of the more popular areas are things like, what's in it for me as the academic? Why should I commercialize my research? Why should I protect my IP? One of the challenges that we might be discussing a little bit is that, as our academics, just want to do the science, just want to get going with their research. They're not really interested in terms of protecting their IP and commercializing, which sometimes has a bit of a dirty connotation to it, unfortunately. But not wanting to be bothered by those rules. But the IP policy basically sets out what's in it for you. And I think a very important part of that is in terms of the benefit sharing. So once they see, okay, there is something in it for me, in terms of the benefits that accrue to the university, this is what I'm going to get out of it, whether it's a share of the licensing income or whether it's dividends from the startup company, it does actually provide, a nice incentive for them. And this is obviously under the IPR Act. Then in terms of IP ownership, I think that's another very, very big thing. And this is important for the industry partners that we're working with. Everybody wants to get a hold of that IP. So, we're obviously, again, guided by the IPR Act to say, these are the circumstances under which the university will own the IP. These are the circumstances under which the industry partner can own the IP, talking about the full cost rates and all of these kinds of things. Again, all legislated, so the same set of rules that we're all playing by. Equity, that's a really, really big one that everybody wants to talk about, because everybody wants a big share of that pie, which at the beginning is really worth nothing. But all of those kinds of things are set up in your IP policy. The second driver, infrastructure, is such a big thing. Because essentially to do the kind of research that we're doing at universities, at science councils, it's not cheap. The equipment, infrastructure that goes into creating that enabling environment is so critical. And I think this is something that industry has appreciated and has recognized. It also allows them to defer their costs so that they don't have to put in that funding into getting in that high-level expertise through the professors and things like that, and they can basically pass that off to the universities. Things like science parks, innovation hubs, these are things that we are trying to create. It's not so easy to create them. It requires a lot of partnerships, and I think that's another critical driver, getting those partnerships going. And we heard in some of our sessions this morning how important those collaborations are. As a university, we really only have access to a very small part of the broader NSI puzzle. So that support from the government sector, from the private sector, in terms of getting those critical partnerships to form that enabling innovation ecosystem is really something that we are striving towards, but again need a lot of help in terms of getting going. Internally, where it's still not so easy is, but again, another critical driver is getting your champions and ambassadors. So something again that we are trying to identify, who within our ecosystem at the university can really, really help us to get these kinds of initiatives up and running. Because really, once you see somebody else making a success of it, you want to follow them. So really, that's what we're trying to get going. And then also just creating those networks and so those are the broad areas really that we focus on. Thank you.
That's great. Yeah, thank you. So we'll move on to, and you guys, I'm not going to lie, I'm very bad at pronouncing names, so you may have noticed I've been avoiding some of them, and I'm going to try to do my best, I promise. But Dr. Galata, if I know you have a slide or two to take us through, so I'm keeping track of time, but we'll turn it to you for your perspective on IP.
I don't know if I can use
Oh,
the
yes.
pointer. Maybe while the slides are still loading, thank you. I think without repeating much of what my colleagues have said, also what we do at the university as the Tech Transfer Office is to also fall around financial and non-financial support, and we are at the mercy of the likes of TIA for funding, so we depend highly, especially for our seed funding projects, maybe at early stage. We are the one who are driving or encouraging our entrepreneurs to apply, provide any support that they will want for them to be able, for example, all those due diligence check, so that by the time it reaches TIA, it's at the level that meets the funders' requirement. So we provide that kind of support. We also not just depend on government funding. We look even through our strategic partners in private sector, venture capitalists, to ensure that our technologies, maybe when they reach certain milestones, they are able also to meet the needs of the funders. And I think I'll just, maybe that slide probably portrays the kind of support mechanisms that we have at the university. So as the tech transfer, we're not just focusing on IP protection, licensing, and commercialization, but also we do have other units that assisting our entrepreneurs, for example, with registering your company, all the regulatory support that is required, because sometimes you find that you have a student, they need to drive research and graduate. At the same time, you also want to satisfy the element of starting a business or commercializing the IP. So we try at least to make the work a bit bearable, or at least manageable, and even for them to be excited to also take the commercial or entrepreneurship route. We also do have an incubation center, which is the Launch Lab, where it doesn't only focus on university-based IP, but also other entrepreneurs who are not university-based. They can also be able to benefit or be assisted within the university. So those are the main driving force that we do. Also, what we've also encountered recently, you find that some entrepreneurs, they'll be applying for maybe government funding elsewhere, and because I think the recent case we had with the DTI, where the need was a technology within the project that required funding, and the entrepreneur didn't have a technology, so they approached us, and we realized that we have the technology that they need. So we also play in that space where we can license the tech so that also it meets the funding requirements. I guess for the sake of time, I'll just pause there. Thank you.
And that was great, thank you. And last but not least, we will hop over to Dr. Nkomo.
Thank you. Just to at least maybe bring a different perspective, I think my last two co-panelists may have touched on basically how a university tech transfer office will deal with innovations from, I guess, TRL 1. No, it's fine. From TRL 1 up to about 6. So for this particular question, I think on IP support, I'll basically just deal with how your usual tech transfer office deals with innovation. So you get, no, it's fine, I'll just answer the question. So what happens is you get an innovator, then through at least IP awareness sessions, those type of activities to try and encourage them, or at least raise the awareness on intellectual property, the importance, and also how you can use that as a tool, basically even in ideation phase. For example, we've just had a pilot program with EPO. So they partner with at least on a platform that's called PatLib. So they'd actually bring in researchers to come in and study, or even just leverage from how to use basically a patent database. How do you use it as an encyclopedia when you're coming up with your ideas on research? So besides just coming up with how do you assess which IP rights to seek, but also how do they use these patent databases? If you think about it, researchers are mainly looking for solutions, same as entrepreneurs. But some of those solutions may already be there. So that incremental research, you also like to think that having access to the next best thing from a free patent database gives them at least a platform on which they can start working on. So we start with that particular aspect in getting them to ways of how better to search for patents, what they need, and what's already in that particular field that they're researching in. Then we can then provide the assistance on which sort of IP rights to seek, be it patents, trademarks, not so much, registered designs, and also whether would it be actually better to attempt using just having that IP in trade secrets, depending on the project and how you look at it. So we provide that particular support. Fortunately and unfortunately, our office is still a bit small, so the portfolio is manageable within 2 or 3 individuals. And also, at least with my background, I can still show them most of that IP assessment part. But as the portfolio grows, we are looking to partner with, as I said, the EPO. So those particular projects, specifically when we're dealing with IP support issues, so we cover that in a nutshell.
Thank you. I think for our last 3 panelists, for those of us that do not have a law background, the work that you guys do can be sometimes intimidating, especially for an entrepreneur starting out. I'll put a plug in that you guys are also speaking on a panel that starts at, I think, 3:30, where you're going into licensing. Is that correct? So if you guys are interested in specifically talking further about intellectual property and licensing, all 3 of our panelists will be speaking right after this. So next question, I think this will be your final question. We'll open it up for Q&A. But very briefly, I think we talked a lot about the enabling environment and the role of intellectual property and universities, the role of incubation and venture capital, the role of commercialization and government. I think all five of you have seen quite a few things and probably mistakes and successes out there. If you were to give a group of innovators and entrepreneurs one piece of advice as they start to interact with your organizations, what would be that one piece of advice that you would share? We'll go down the way again.
Right, thanks. Bethany, from my vantage point, we need to get the entrepreneurs to appreciate market access. So basically, there's a misconception out there that just because you're an innovator, you are this intelligent person necessarily, and you're bringing up or coming up with a technology that is so good. The assumption there, which is a fallacy, quite frankly, is that it will be so good that it sells itself. It doesn't happen. Real life doesn't work that way. So we have to be intentional about conscientizing our entrepreneurs on market access. When it comes to engaging with the partners on the small matter of market access, quite frankly, it will be so much easier for me with my tier title that they've entrusted me with to call somebody respectable in industry to give audience to a new idea than it will be the case for a random entrepreneur off the streets or some lab coat fellow to get the attention of somebody very senior in the destination market of interest in terms of how the IP will be commercialized. So market access, and market access. Thank you.
Market access.
And I think I would go with the other side of that coin, which is the customer. And I think it's the same conversation, but starting with the user in mind and not falling in love with your solution before you have properly characterized the problem. So, people talk about human-centered design a lot, but I think a lot of people do not spend enough time really understanding the needs of the users and the customers before they really start developing. Now, if you've already started developing your solution, I think it would be important to take a very big step back and really talk to your users, really do a lot of user research and talk to people. Just talk to the humans that will be using your solution before you really fall in love with it.
So I think it's 5 words. Go to your TTO early. Okay, 6, please. and the reason that I say that is because, so often we come across, these amazing technologies, these amazing innovations. And, we just sort of like get so frustrated because it just has become so unnecessarily complicated because we were not consulted early enough. So think of us as, sort of like your TTO dentist or your innovation dentist or your financial planner. The earlier you consult those kinds of specialists, the better it is. It's you as the academics have your areas of expertise being the research. Innovation is our area of expertise, and we're not here to make your lives difficult. We're here to make your lives easier, right? But when you consult with us much, much later on, after all of the problems have been created because contracts have not been put in place, etc., the IP has not been protected, you can't get a patent anymore because you've lost the novelty through publishing or given it away to the industry partner, there's then very little that we can do in order to help. So come to us early. As soon as you think that there is potential for patenting or commercialization, we're here to do those things for you. We're here to negotiate with industry for you. So yeah, that's my advice. Thank you.
Just to add on that, consult us early, as Dr. Singh says. And also one of the things we've noticed is that because now, especially as the TTO, we're thriving between meeting the balance of knowledge generation and commercializing. So especially with the young innovators, where you find that either they're at the mercy of their principal investigator who's more into publication. And sometimes it's a good project, but there's no champion because the PI is chasing publication. So I like to encourage young entrepreneurs and young innovators that don't wait. Maybe if your principal investigator has missed the opportunity, if you see that opportunity, consult the tech transfer office, and also with the senior researchers. I want to encourage you as well that create opportunities for the young innovators, because at some point we're gonna lose you in the system, you're gonna go retire, and we need to build that pipeline. If we don't do that early enough, there'll be so many missed opportunities. And also leverage on the networks that are there, and because you realize that some of the struggles you have in your little corner could just be solved overnight if you have consulted and you go to the expert in IP, expert in business development. Also the good thing that what we're not able to do within the tech transfer office, we are able then to bring our strategic partners, to bring consultants that you're most likely not to have funding or sufficient resources to maintain the services. So the university is there to de-risk that. So take advantage of those opportunities. Thank you.
There's a question I think I've been asked a couple of times this weekend. The university owns my patent rights. If there's anything that you should remember as a take-home, at that point, if the university is the applicant, it shouldn't worry you. You're still the inventor. That's the most important part. Whether the university is the applicant and owns the patent rights for some time, that shouldn't worry you. The reason being, at that point, if you think about it, you're still a startup or you're still fairly small, shouldering the liability of patent prosecution and all of those, you don't necessarily need that. The university is already using taxpayers' money to actually get those rights for you. You are still the inventor. You drive the innovation. They'll still license it to you at the end. So don't worry about they own it. They own it.
Thank you all. I feel like that was a really good summary of advice. So I hope you guys are taking notes between understanding market access and leveraging networks in order to do so. Focusing on your customer and user-centric design. So make sure what you're designing, you may be really excited about it, but it can't go anywhere unless there's someone who's willing to use it and pay for it. I like the third one of go to your tech transfer office, please. I also think that you should have a new tagline for the tech transfer office of your innovation dentist. I also heard to consult early with tech transfer and leverage your network, which I think is always really valuable. You're not doing this alone. There's lots of partners out there to support. Being an entrepreneur is difficult enough. And then finally, just remembering that you are the inventor when you're working with your university. So thank you guys all for those insights. We are almost out of time, but we can open it up for one question if it's a really good question. Does anyone have any questions for our panelists? It's the session right after lunch, so I have a feeling that people are still waking up. No questions? Oh, we have one question.
So it's probably more of a comment than a question. I listened to sessions earlier and I listened to this, and there's a very large focus on intellectual property. So my thoughts around this, and I've been in this national system of innovation for a very long time. Do you, as a panel, have a view on whether our constant focus and on intellectual property and how to share it, and is that not by some means stifling the emergence of a bioeconomy in Africa? And the reason behind this is that throughout my entire career, before you have anything to fight about from an intellectual property perspective, we start fighting. Talking about who owns the intellectual property, but you have nothing at that point in time. So it becomes that we've so focused on how we're going to share something that we haven't even invented yet, that people don't want to get into these collaborations. So it's just a thought. I'm not sure if anybody wants to take a chance at responding to it.
You have a microphone that's on.
Yeah. You see, Deepak, thanks for the question. You see, the underlying asset against which we invest is intellectual property, right? So we cannot talk about it. We cannot focus on it. However, where you make a good point is that often the obsession with fighting about the rights that haven't come into existence is often to the detriment of the bigger commercial picture, whether it's bioeconomy or other industrial sectors. More must be done to shift the lens towards the market. More must be done to shift the lens towards the fact that we develop these assets in response to commercial problems. And more must be done to support these innovations from a commercial standpoint. So I fully share your frustration, and I think we don't have to defend ourselves. We must just intensify efforts on the market. Thank you.
Is there any other response?
So, okay, all right, thanks. So I have two kids, a 3-year-old and a 5-year-old. So the same principle that I try to teach them is what I apply to this problem. Share and know how to share, learn how to share, otherwise neither of you will get it. right? I will just take it and I will keep it away. So it's, I mean, we are facing this problem constantly in every transaction, in every negotiation that we come across. It is that same age-old argument, you know? Everybody wants to have the biggest piece of the pie. And if you don't learn how to share equitably, such that, you know, it's a win-win situation, everybody's going to be a loser, right? So we need to learn as the universities, as industry, other science councils, etc., how to make it such that everybody is a winner. Because until we do that, we're never going to thrive, right? And if you look at, you know, I mean, you know, where it's done well, like, I mean, in the States, in Europe and things like that, the very, very successful TTOs have this relationship with industry where industry is continually supporting them. They're continuously putting money into those TTOs. Why? Because they have already formed that partnership where each recognizes its value. It's not like industry, I mean, a lot of industry partners that we come across with are like, you know, but there is no value in this IP at this point. You know, we're going to add all of the value, right? Not recognizing the value that the university, science councils, etc., have had to historically put in place the infrastructure, etc., in order to get that IP to where it is. It might be very, very low value at this point, but a lot has already gone in, you know? So recognition of what each party has added or is going to add and being compensated fairly for that. Thank you.
I think we have two more panelists that would like to speak, so we'll go to, I think I saw, you made eye contact with me first. So we'll go to you first.
Thank you so much. I think the point I wanted, I think Dr. Singh covered me on the fragmentation part. And I think maybe the obsession with IP for me is not so much an issue, but this whole thing of being, because I think for more than a decade now we've been talking about our system is fragmented, but unfortunately we don't seem to be bringing solution to that fragmentation. So we keep on competing for the same resources, and as a result of that, now everyone wants to have that bigger piece of the pie. And also my thinking as well is that maybe one of the things our policymakers need to help the system with is also maybe to reduce on the overregulation, because at the same time, as much as we also need to respond to the governance or regulatory framework of making sure that we protect the IP, also because of that overregulation, because you go from your NIPMO to your SAPRA and to your SARS, there's a lot of paper trail that needs to be taken care of. And unfortunately, we are mandated to do that. And if we don't comply, then also the entrepreneur or the innovator is in trouble. So perhaps we maybe need to meet that balance that we don't overregulate, but also ensure that we at least at the same bar with what our international partners are doing. Thank you.
Okay, and we'll give the last comment to Ms. Nabarro.
I love getting the last word. So I'm a big proponent of open source innovation. And I'm very sure that my friends who deal with intellectual property will not be very happy with me trying to say that I want to put them out of a job. But honestly, to your point, I really do think that it does not serve us well to be spending time sort of going round in circles, worrying about who owns the intellectual property when we could be solving real problems that we have on the continent, actually in the whole world, but specifically on the continent. And I think if we could get to a place where we could figure out a way to have more open innovation, I think we would do much better. And that's all I'm going to say on the matter.
I think that was a good closing word. I appreciate it. It's left on a hopeful note and one of collaborative effort, so I appreciate that. I want to thank you all for being here for the panel today, and thank you to our 5 panelists for your words of wisdom and inspirations. Thank you so much, and that concludes our session. Thank you. I panicked when I left.
1 2 1 2 1 2 1 2 testing 1 2
Thanks for joining us for today's session. My name is Neil Kubinelli. I'm the Dean of Research at the University of KwaZulu-Natal. I'm filling in today for Professor Mosha Moshabela, who's away at the moment. He's the Deputy Vice Chancellor of Research at the university, and he's asked me to fill in for him while he's away. So today's session is about win-win North-South collaborations, and I'm hoping it's going to be a very interesting session today where we get to see some collaborative efforts between the North and the South, and maybe info and insight as to how we can actually benefit by collaborating together. We have 5 panelist members, 6 panelist members, 2 joining us via Zoom. Dr. Tom Evans, the Executive Director of the New England Biolabs in the USA, will be joining us via Zoom. And maybe we'll begin with the other panelists, and as he joins, we can invite him to talk. Our second panelist is Dr. Lawrence Banks. He's the Director General, and he's to my left. Dr. Lawrence Banks is the Director General of the ICGEB in Italy. And then we have some panel members to my far left. We have Mololeni Batu, Joseph Fokum, and Eric Lelo. They're to my left, and they're also going to contribute some discussion to today's panel session. So without any ado, I'm going to invite Dr. Lawrence Banks to give us a short presentation on the North-South collaborations.
Okay, so thank you very much. Good afternoon, everyone. It really is a great pleasure to be here today, and thank you so much to the organisers for giving us this opportunity. So if I could have my slides, that would be great. Thank you. So this session is really focusing on some brilliant collaborations that we've had with our colleagues in Africa. On the panel today, we have Eric Lelo, who's from Kenya, Joseph Fokum, who's from Cameroon, and Mololeni Butu, who's from Ethiopia, and also our really tremendous colleague who unfortunately couldn't make it for visa issues, Maro Salim Baba from Nigeria. And all of what has been happening over the last couple of years related to COVID-19 is going to be really the focus of this session. And really, I'm really hoping that Tom will be able to join us from New England Biolabs, because they have been really the backbone of this project. Before getting into what we've been doing in that particular aspect, I'd just like to give you all a little bit of background about the ICGB. We're an international organisation, and we have 66 member countries located throughout the world, as you can see here. And as you can also notice, we're really very prominent in the global south. And unlike most agencies doing development-related activities, we also have our own laboratories located in centres in Trieste, in New Delhi, and also in Cape Town. And we have a very straightforward mandate, and that's to be a centre of excellence for research and training in molecular biology and biotechnology, specifically addressing the needs of our member states. And I like to think of us as using science to promote development. I'd just like to add that we're very active in Africa, and we have many new states that are joining the organisation. As you can see, we have a pretty good distribution of member countries across the continent. And recently, we've had Ethiopia has recently joined, Angola has recently joined, and so has Zimbabwe. And we have new members expected to join within the year from Djibouti, Rwanda, and Botswana. So really, we're really in a very much an expansion phase. These are the different activities that we pursue to fulfill our mandate, and I really don't want to go into any of these in any particular detail. I just want to highlight a few of the programs which I think might be relevant to this audience. Obviously, with having great scientific capability, we can provide a whole variety of different fellowships, whether they're for PhDs, postdocs, or short terms. And we're particularly active in providing fellowships for Africa. This is a recent program that we developed with the support from the Italian Ministry of Foreign Affairs, and this is to provide fellowships for women scientists from Africa. And I think we all agree that gender equality is such a major part of what we're all trying to do with development of biotechnology, and so having specific programs for women I think is really tremendous. And likewise, we also teamed up with the UN Office on South-South Cooperation, again providing fellowships for women scientists, in this case particularly from least developed countries, and as you all know, that renders many countries in Africa eligible for these fellowship opportunities. And these will be taken up in the labs in New Delhi and in Cape Town. We're also very active in supporting meetings and courses. We're a major partner for Africa Bio, which for us is a really fantastic meeting. But just to highlight, we do these all over the world. And so if any of you are interested in ICGB's meetings and courses, please do get in touch with me. We're always looking for new venues and new partners to host these type of events. I'm just back from a meeting in Zimbabwe, which was held in Harare, which was actually focusing on my own area of interest, which is HPV and cervical cancer. And we were really addressing aspects that were really critical about the virus and about the disease in low resource environments. We are also a grant funding agency, so we do provide research funds for our member countries. And this is just to highlight one such activity that we have, again supported by the Italian Ministry of Foreign Affairs in the Horn of Africa, which is providing fellowships, it's providing grant funding opportunities, as well as international meeting support. And I'd like to move on now to aspects related to technology transfer, which is really, I think, one of the major points of this particular session. And just to emphasize that ICGB has a whole variety of products that have gone off patent and which are all available for transfer to our partners in our member countries. Why are we doing this? Well, it's cost. If you look at these products and you look at the originator price and you look at the price that we can provide based on the technologies we transfer, it really does offer massive savings, and it really is, I think, one of the ways in which you can really get products produced on the ground in Africa at prices where everybody can afford it. This is what we've done so far, many agreements, many transfers around the world, but we really want to see more being done in Africa. And so again, if anybody wants to talk to me about this, I really would like to discuss it further. And a lot of what we provide is now also available online, and this was obviously driven by the pandemic, but the technologies that we offer, it really gives people a very good opportunity to see what it entails to produce these types of biotherapeutics. And this is just one of the facilities that we have. And we don't just offer transfers, but we also offer capacity enhancement. So training in production processes and quality control and building that human capital, which I think is absolutely fundamental. In New Delhi, we're also very... And the director, Dinner Solanki, said quite a bit about this yesterday, is really pushing, and these technologies are available, as are many of the technologies associated in the agricultural sphere, and particularly in the areas of bioremediation, biofuel production, and carbon capture. And finally, we're also very active in the area of microbiomes, where we're actually developing biofertilizers for use in field in member countries, with many collaborations taking place on the African continent. So what I'd like to just finish with is to highlight the work that we've been doing with our colleagues in Nigeria, Ethiopia, Kenya, and Cameroon. This was really driven by New England Biolabs. Rich Roberts sits on our Council of Scientific Advisors, and when we met, just as the pandemic was starting, he said, we have this fantastic technology, a lamp diagnostic, which can be used to diagnose COVID-19 much more effectively, especially in a low resource environment, and also much more quickly. And so we teamed up with our colleagues, 3 of whom are with me today, which has been it's been an amazing collaboration, but it's the first time we've got to meet in person, which is fantastic. So, and this was, I would have to add that all of what I'm going to show was provided completely free of charge by New England Biolabs. So all the kits, all the reagents, they've just been a fantastic partner to work with in this. And we've had also some really very nice support from the Bill and Melinda Gates Foundation in this activity. And really, the technology is very simple. It's an isothermal reaction to detect SARS-CoV-2. It's a color reaction. It can occur within 30 minutes. It's very easy to score, but my colleagues here will probably say a little bit more about how it works in different environments. And the bottom line was that it was actually extremely effective. So this involved a clinical trial that we developed with the 4 labs in Africa. The results have been published. It was found to be as reliable as regular PCR at medium to high viral loads, and it's ideal for a low resource, especially where you have intermittent power supply. I think this technology is extremely good for that. And it also brought out some quite interesting science as well. Some of the PCR tests were missing variants, whereas the LAMP technology was actually very good at detecting those. I don't want to steal any of the thunder from these guys, so I'm not going to go into what they did and the specifics of the results, but I'd just like to say that this project has not come to an end. We're moving forward. We really want to try and roll out this technology. I think it's valuable for SARS-CoV-2, but I think the LAMP diagnostic is also extremely valuable for other pathogens, and the plan is to move forward into developing additional therapeutics. And we've now got additional countries on board across the African continent, with a major contribution being also provided now by the labs in Cape Town on disease surveillance. And I really think this is a network that is really the way to go in terms of addressing the problems and the issues in different regions on the African continent. And ICGB is really delighted to be working with all of the teams. And the idea is obviously to develop local production facilities, and ultimately we're hoping that we can use these networks to trial novel diagnostics that are in the pipeline, and to really ensure that such diagnostics can actually work in remote communities and remote environments on the African continent where they're desperately needed. And so with that, I'll stop. Really, this is what we do, and that's my email and our website. So if anybody wants to contact me at any time, please do so. So thank you very much.
Thank you, Lawrence, for that nice presentation. I think it's a perfect example of how the North and South can actually collaborate, and we'd like to see some of the inventions that we make in Africa being produced in Africa and being used by Africans. So it's actually quite a nice collaboration that can come of this. And it's interesting to note, and look forward to the next 4 speakers who can actually tell us what inventions that have actually been made in Africa and how they've gone about it. But before that we do that, I just want to see if we do have Tom Evans on the line. If we don't, we can proceed. But do we have Tom Evans on the line? No, not yet. Okay, so I think we'll proceed. And I'm going to invite Mololeni Batu from Ethiopia first to give us a short presentation on his inventions. And
good afternoon. Can I have my slides? No, it's not mine. Okay, this is mine. Thank you very much again. Good afternoon. My name is Molla Limbito. I'm coming from Ethiopia. specifically from the Bio and Emerging Technology Institute. I am a scientist working over there. I have been collaborating with Dr. Lauren Banks and his team, and I will show you what my institute is working, and specifically on COVID-19 pandemics. Sorry. Yeah. Okay. My institute, Bio and Emerging Technology Institute, it was named the former Ethiopian Biotechnology Institute, and it was established in June 2016, but changed the name in 2021. Let me show you something about the COVID pandemic in Ethiopia and what was our contribution. We in Ethiopia tested around 5 million people, and 492,000 people were positive for COVID, and around 5,500 people were positive for this infection, and the disease was different according to the regional states in Ethiopia. We have 89 laboratories which have real-time PCR capacity, but currently all of them, they stopped, they are inactive working on real-time PCR, but we are doing antigen-based rapid diagnostic test. And we have around 638 facilities throughout the country. So what was our contribution during the pandemic? We are a biotech institute, but we were working as a diagnostician. We started testing actually on 15 April 2020 using 3 real-time PCR machines. We tested daily 1,000 samples per day. Till we stopped, we tested 72,000 samples. Apart from testing, we have been working with different laboratories, research institutes. We have been also training laboratory diagnosticians during the testing campaign. We have been also involved in the National COVID-19 Research Steering Committee, and we secured different national and international COVID-19 related research grants. Among them, I can mention most of them, they are from ICGB. The first one is like the COVID-19 Establishing a Rapid Laboratory Diagnostic Program in low and middle income country. That was RT-LAMP from nasopharyngeal samples. And we found that RT-LAMP was one of the best methods we have seen in our system, because we used to do different kinds of diagnostic methods, but RT-LAMP was the best. Just recently also, we are working with ICGB on diagnostics of SARS-CoV-2 using the saliva as a sample. And this is also one of the best methods that fits to our purpose in Africa. The sampling is very simple. The sample saliva we can get, it's non-invasive. The test RT-LAMP is also very simple compared to the RT-PCR. And the other ICGB support was the CRP, Coordinated Research Project. ICGB supported for sequencing of SARS-CoV-2 in Ethiopia. We used this fund to sequence the variants, the viruses circulating in Ethiopia, and we published it in a very good journal. So a lot of help was there in ICGB for us, and that kind of collaboration will continue definitely, because all the details was mentioned by Dr. Banks. Another thing we did for my institute is there is also a collaboration between BGI, Beijing Genomic Institute, and BETIN, Bio and Emerging Technology Institute. So BGI has a facility in Ethiopia to produce COVID-19 testing kit, and BGI is currently manufacturing 10 million kits per year. This is the collaboration we have, and this is what I would like to show you. Thank you very much.
Thank you, Moleleni. I think, COVID-19 has taught us a few things. And one of the things it actually has brought to us, it has actually brought science to the people. I've never seen so many scientists feature on the news as I've seen once COVID-19 hit in 2020. And I think almost every day for at least a 6-month period, we had scientists on the news. And PCR, many people used PCR. They didn't even know what the acronym meant. But I remember way back, learning about the polymerase chain reaction in second year biochemistry, and then probably forgot about it, from then on, and then seeing it being used as a common term, people wanting to know, can I take a PCR test, and what's the difference between a PCR test and another test, and so forth and so forth. So I think we're taking science to the people, and I think the awareness that we've made since COVID-19 is very, very important as well. And I think, the types of research that we're doing and taking that research and commercializing it and making it available so that we can use it and give it to people in something tangible is actually quite welcome. Our next speaker is Joseph Okum, and he's from Cameroon, and I'm hoping that he can tell us something about the inventions that happened there that's very topical. Joseph, over to you.
Thank you, Mr. Chair, and I'm happy to be here, really. Good afternoon to everyone. I really want to thank the New England Biolab for this opportunity. So I'm Joseph Fokam. I'm the head of our virology laboratory. I'm also a lecturer in virology and a member of our national COVID-19 response team. So just for a snapshot, how is COVID-19 in Cameroon? Actually, in Cameroon, we have so far more than 120 positive confirmed cases for COVID-19. We currently have also a very low case fatality rate, approximately less than 1%. And in our context also, we do have about 11% who are currently vaccinated in the target population, and vaccine hesitancy in our context also is very high. We have approximately less than 5% people who have taken the vaccine in the urban setting, and this is mainly due to social media related misinformation. We also have approximately 50% of health staff who are currently vaccinated. And in our center so far, we have contributed with approximately 75,000 PCR COVID-19 testing. The country has gone through 4 different epidemiological waves, and actually in the country, we are seeing like a new upsurge in the very last week, so maybe we are going towards a 5th wave in our country. So within the frame of our COVID-19 response, we were lucky to work with New England Biolab on this project. So we had to evaluate the nasopharyngeal swab on RT-LAMP PCR assay with an overall sensitivity of 83% and 100% specificity. This was done in reference to the Abbott molecular diagnosis system, which is commonly known. But more importantly, we realized when we go down with a CT value of less than 25, we have approximately 100% sensitivity also. So the RT-LAMP assay based on nasopharyngeal swab gave an excellent result in terms of detecting COVID-19 cases and also in terms of preventing transmission within our communities. Then down you have results from the other laboratories in the project. We have data from Ethiopia, data also from Kenya, data also from Nigeria and from Italy, really showing similar results in different countries, assay being performed by different people on different samples, really having similar results. So we're really encouraged to use RT-LAMP within our context. Then we now thought of using RT-LAMP in a very simpler way. A simpler way means we need an assay which is not going to use RNA extraction in any molecular laboratory. We also need an assay which can be done on saliva. So during the conclusion meeting of that phase 1, we were also encouraged to join phase 2. And in this phase 2, this is like our preliminary result of what we have done so far in the phase 2 project. We have enrolled 81 samples that we have tested already for both PCR and also for saliva RT-LAMP. So we read the result 30 minutes thereafter. We did staff training on how to read the change in color between time 0 and time 30, and we make sure result was interpreted by 6 staff to be sure we really have concordant in terms of data validation. So what we have so far as preliminary result, we compare the RT-LAMP on saliva with the conventional real-time PCR system. At a CT value of 40 threshold, we realized we had approximately 86% sensitivity, we had approximately 96% specificity, then we have a kappa of approximately 80%. So we also realized there was a sample that was positive on RT-LAMP and negative on the conventional PCR. So we hypothesized this could also be a case of a variant which has a mismatch with the current PCR system. So here we need to go in for sequencing to confirm this result. So sequencing will be done subsequently. Then we also evaluated the same assay, RT-LAMP, using a CT value of 33. And at this level, we realized the sensitivity was 100%. So meaning that for moderate and high viremia, RT-LAMP was able to pick up all the cases that we tested so far with PCR also. And we also had approximately 96% specificity. Then the kappa, which the concordance went up to about 0.87%. So you see, RT-LAMP on saliva without doing any extraction is a 1 test tube go for 30 minutes. We really have excellent result. So this could be used not just for urgent clinical cases, but we also have patients who are people who have to travel and they have urgent flight. This assay also could be of high relevance in terms of serving the community for COVID-19 rapid PCR and reliable assay. So what we had like a preliminary conclusion for this phase and the way forward, we realized the assay is highly performant, so we will need to have a kind of validation of this assay. Then thirdly also, we also like this assay in our context to be used widely after it has been validated, and we are also recommending to communicate this preliminary finding within our local national settings such that our regulatory company will also endorse this assay for clinical use. So we really want to thank all the participants and also our borders country for this result. Thank you.
Thank you, Joseph. That was quite interesting. I think we also highlight the need for these rapid tests. And I think, when the public goes out, and even before we come into a venue like this, it might be worthwhile to have a test outside where you could probably put your fingerprint or put your thumb onto something, and that will quickly tell you if it turns blue, you're fine. If it turns green, you're not, etc. And so at least you know whether or not it's safe to get into a venue or not, especially now that I see that people are leaving countries and we find that the virus is sort of originating in a certain place and then travels from the north to the south to the east to the west in a matter of 24 to 48 hours. I mean, in the global world that we're living today, we generally need these rapid tests. So thank you for that fine talk. Our last speaker on this panel, and then we'll just go to see if we have people on the Zoom call as well. But our last speaker is Eric Lelo, and he's from Kenya, and he's going to tell us about the inventions in Kenya. So Eric, over to you.
Good afternoon, ladies and gentlemen. Mr. Chair, thank you for the opportunity to come and highlight our situation in Kenya. If I may have my slides, please. So, I'm going to give you a snapshot presentation of the situation that we had in Kenya in relation to COVID-19. And I want to outline the challenges and also the opportunities that came with this condition to our country. The first case of COVID-19 was confirmed on the 13th of March, 2020. And like in all other countries, measures were put in place to control and contain the spread of the disease. The institute, the government actually set out several institutes to come and assist in the containment of the conditions. So we have different level laboratories in the country, the highest being level 5, and the next to that is level 4. So all the level 5 and level 4 hospitals were put on alert, and they were called into play to assist in the control of this condition. Other than that, we also had non-pharmaceutical interventions, such as wearing of masks, social distancing, and also we had isolation. Healthcare personnel had to be trained quickly so that they could respond to this condition, so that they could help in the containment of the same. And other than the healthcare personnel, also the security personnel had to be trained because they were also playing a role when it came to measures that were being put in place, such that the restriction of movement, which in my country we called lockdown, that took place several times, and so they were also trained to respond to that. So finally, the backbone of the control and containment measures was in the mass testing of the population. This was put in place immediately after the condition was identified, and centers were set for mass testing. The situation in Kenya at the moment is looking good. Kenya experienced 4 waves, the last one being of the Omicron, and each wave came very strongly and faded away again with time. Currently, we do not have a serious situation in our country. The number of cases have gone down, but we've been experiencing that on and on, because in December last year, there were many cases that were being reported, and then later on in January, February, March, the cases went down. Right now, again, they were up, but the last 2 months, they've also gone down again. So the challenges that we had at the initial stages was that we only had 2 testing centers across the whole country. And one of the testing centers is from the institute I'm coming from, which is the Kenya Medical Research Institute. Kenya Medical Research Institute is a big institute, and it has satellite campuses across the country. So in our day-to-day life, we were used to doing research. Our mandate was just to do research. But like we all know, COVID-19 was a game changer. So we had to be mobilized because we had the relevant technology at that time so that we could assist the government with the mass testing and with the aim of containment of the situation. We also had the national laboratory labs, which also operate under the Ministry of Health. So the 2 institutions were mandated with the testing of the suspects, so that the government could put in place containment measures such as restriction of movement and also isolation of patients and contact tracing. So other than that, we had also challenges with COVID spread, and we had schools being closed. We also had hospitals having an overflow of patients and running out of capacity. ICU beds and high dependency unit beds were not available anymore. And also we ran into problems in the sense that in as much as we wanted to test a bigger number, it was not possible to do so because we did not have the capacity to do so at the moment. But later on we got donations of test kits that came as a positive thing, and I'm also going to mention the negative aspects of those donations. But these donations came, and we were able to do our testing. And this was good because they were in large supply, but most of them were coming from different countries. We got some from China, we got some from South Korea, etc., etc. And that created a challenge. So all that is a list of variety of test kits that we got as donations. The problem with this is that for every kit that was coming as a donation, it was coming with a different protocol. So each and every time we had to train and adjust to use the new protocol. Some of them were relatively easy and straightforward to use. Some of them were very complicated. Now, this also created a variation in the reporting because we had a national tally center that was keeping the statistics of the situation in the country. So whenever we got a new kit from a new donation, there was a lag in the reporting that was being experienced. So this was not very good for us at the moment. As my co-presenters have mentioned, the gold standard technique of testing for COVID is the RT-PCR technique, which is a very good and reliable method. However, it has its drawbacks in the sense that it requires expensive equipment, it requires reliable supply of energy, it also requires trained personnel to interpret the results. And all these were creating a challenge because in my country we have, for example, a problem with reliable supply of energy. So occasionally we could have a problem with the availability of electricity, and this would slow down the process of testing. And basically we know that testing is important, prompt testing is important because it will lead to faster isolation, faster contact tracing, and faster containment of the situation. So we were delighted when we partnered with ICJEB to work on a LAMP test kit that, unlike the RT-PCR, is very straightforward. And I'm going to show you how you interpret the results in a very straightforward way. So we were really delighted to get into this partnership. So at our institute, we are normally broken down into centers or campuses. So the two centers or campuses that came into this collaboration was the Center for Virus Research that was already operational. And basically before COVID came into play, they were actually doing surveillance on other respiratory viruses. So they were very well equipped to deal with respiratory viruses. And also we had our Center for Biotechnology Research. In this center, where I am also actively involved, and one of the senior scientists in the center, we basically do biotechnology research. And part of the research that we do is LAMP-oriented. Like, for example, before we got into this collaboration, we already had LAMP tests that were going on that were based on diagnosis of other parasites, such as the soil-transmitted helminths. That is a big problem in our country. So our labs have well-trained personnel, and we are also well-equipped at the national level. But the community labs do not have the advantage that we have at our national level. So when this LAMP kit was brought to us to develop, we were excited about it because it is a kit that you can be able to operate at the community level laboratories, because it doesn't require a lot of, it doesn't require energy, and also it is isothermal amplification, meaning that you can do the amplification without the requirement of expensive equipment. So the interpretation of these results is very straightforward. It is based on a color change, and as you can see there, you can easily detect the difference between a positive and negative if you compare the controls that we have on top with the samples that are below the line, above the line that is below there. So basically, we were able, this is part of the experiments that we did, and we were able to confirm that the LAMP kit is equally reliable, and it is comparable to the RT-PCR test, and it can be able to be used in this situation that we are in at the moment. And another advantage that it has is that we only incubate the samples for 30 minutes, and we are able to get our results and interpret them and send the results back to the patients for treatment. So we also, as my co-presenters have mentioned, we also tested saliva-based tests, and these were equally comparable with the nasopharyngeal swab. And the saliva test is more amenable because people accept it because it is non-invasive, unlike the nasopharyngeal swab that actually most people do not want to be exposed to it. So this saliva-based test was actually a good approach, And we have tested it in quite a number of samples, and so far it is very promising as a test, and it is comparable to the nasopharyngeal samples. So this has offered us a lot of opportunities. We have had our manpower trained, and we are going into the rollout phase of it. We are getting the kit registered by the Pharmacy and Poisons Board, and this will improve testing and coverage. I want to thank all the donors that have played a role in this, ICJEB, NIB, and BioAfrica. So thank you very much for your time.
Thank you, Eric, for that talk, and I think it just shows us how important it is to have a test that's friendly. You'd be surprised at how many people are actually afraid to go to the doctors and afraid to actually get tested. So if someone can actually produce a sputum that can actually be tested and give you a result that you need, that will be very, very desirable for the virus detection. I think we managed to get our Zoom participants on the line now. So maybe we'll take Maricel and Baba from Nigeria first. Oh, Tom. Okay, let's take Tom first. He's joining us via Zoom, and he'll give us his presentation, and then we'll go to Maricel last. So Tom Evans is from the New England Laboratories, and he's going to give us a presentation. Welcome, Tom. You're in a session in the BioAfrica conference. So if I can invite you to give your presentation.
I'll start sharing my screen. I hope you can hear me.
Yes, perfect. Thank you.
All right. And thanks to all the technical support people. I know how frustrating and difficult it can be when things go awry. So I appreciate all their hard work. Can you see my screen?
Yes, we can. Perfect.
All right. So I'm going to get started. I hope you're all having a great afternoon and a wonderful conference. I wish I could be there. I do want to start by also thanking the conference organizers for the opportunity to give this talk. I'm going to give a slightly different talk. I'm going to give a little bit of background to New England Biolabs, and I thought a fun way to do that would be to talk about what I consider two core values of the company that has made us success from being a startup in a basement in 1974 to a multinational today. So obviously, the success of a company is more than two values, but I thought these were interesting ones and integral to the company. And they were imbued in kind of our culture from the very beginning by our founder, Don Combe, who's pictured here. So the two values I want to talk about today are innovation as the business and to give back. So we'll start with innovation as a business. So I think, as opposed to talk about this, that I would give an example of that and how Don kind of perpetuated that throughout our history. When the company was founded in 1974, our first product line was tRNAs, actually. And the reason for that was Don was interested in this brand new technology, in vitro transcription and translation. And he wanted to start a company that produced reagents to allow new technologies and new markets to emerge faster. He was a little ahead of his time, and so the tRNAs didn't sell very well. And I think this is very telling, because I think a lot of new business owners would have probably, who desperately needed to have some income, would have probably started their second product line to be geared towards a mature market. But not Don. He chose a new also a new area, at that time, molecular biology. And so he's released restriction enzymes. With the same idea, trying to produce products that would help new technologies and new markets emerge. There was a second big risk, actually, for a company that didn't have much income, but his timing was good this time, and molecular biology took off, and clearly it's impacted us significantly to this day. The second thing he did was to create essentially a backbone or a composition of a company that would be able to take advantage of this kind of risk-taking and looking for innovation and to stimulate innovation. To this day, more than half of the employees on our Ipswich campus in Massachusetts are actually scientists engaged in basic and applied research. So clearly they make products, they file patents, but they also publish papers in peer-reviewed journals. And the idea is to be part of the scientific process, to engage with scientists, and in that way to help drive innovation forward. So the second thing, the second concept I wanted to touch upon was to give back. And I'm not going to go through this list. I do, however, want to focus on this concept of a parasitology research program. When New England Biolabs was financially successful, Don did want to give back to the community and the world in various ways. And I think one of the more interesting ones was he wanted to fund research at New England Biolabs that would lead to a positive impact outside of the company without commercial gain. And so he chose to fund research labs working on parasitic nematode biology. The idea was to publish papers learning about the biology, and hopefully some of that knowledge would stimulate some innovation elsewhere that would lead to treatments to these horrible diseases. It's easy, they're very difficult to cure these diseases, but we've been involved in that kind of research ever since the early 80s. You know, that's many decades of research in parasitology, and I'm not going to cover it all here, but I do want to touch upon where it is kind of currently and how it stimulated a lot of the discussions that are being had today that unfortunately I wasn't able to view all of them. But in 2016, a paper was published by Tilda Carlo in her lab here at NEB, and they were working in collaboration with a number of scientists in Ghana, and their desire was to take another technology developed here at NEB, which is by Nathan Tanner and Yinhua Zhang, which was a colorimetric test to detect for the presence of a particular DNA. If the DNA wasn't present, the tube stays kind of this reddish pink. And if there's DNA present of a specific sequence, it turns yellow. It uses a lamp, as you've been discussing already in this session. They took and they merged a need with this technology, and they wanted to have a rapid and easily used technique to determine if a person has onchocerciasis, and then they could get the right treatment. So as I said, this was published in 2016. That was 3 short years before our current situation of a pandemic. And when that pandemic struck, or began actually, before it even left the Wuhan locale, Nathan Tanner and Yinhua started working with scientists in Wuhan to take that technology and instead of detecting onchocerciasis, to detect SARS-CoV-2. And that was successful to the point we made a product that became of interest to ICGEB and the Gates Foundation. And through their connections into countries in Africa that I know you've been listening to a lot of those talks, identified 5 clinical labs that really were interested in giving this a try. And it's been amazing to work with these scientists and get their feedback on this technology and understand its strengths and weaknesses even more. And that very large study resulted in a publication that details all of that, which I'm not going to go through here, obviously. But I think it's an interesting story in that how it leads science in the world is kind of meandering, and it should be embraced. If you're looking for innovation and looking for ways to work with people and trying to give back, you find new technologies and new ways of dealing with problems. And so I just want to end there to say that, yeah, there's many things that lead to successful company, but looking to drive innovation and giving back, I feel has contributed to NEB's success and stability for almost 50 years. And it also makes it a very fun company to work for. I've been here for 26 years and it's still a lot of fun to work here. So with that, I just want to say thank you for listening to me and this talk, which is a little different than the other ones. And I'll be happy to answer any questions at the appropriate time. So thank you very much.
Thank you, Tom. That was quite interesting. It's also a good perspective to see how we can take science and make it topical and make it used by all, and then develop some technologies that can actually drive the process. We're going to take our last speaker and then maybe start some discussion. And our last speaker is Miraselin Baba from Nigeria, and he's going to tell us.
I think
He's
they're
off.
still having trouble.
Okay.
So maybe we should see if there's any
Sure.
questions.
Yes. Sure. So we're going to take some questions now because we can't get to Miraselin on the call. So if there's any questions that you'd like to ask the panel, we can start from there and then start a discussion. So I invite you to probably let me know if you have questions for the panel. Yes, Mohammed.
Should I use the mic?
Yeah, please do.
Thank you so much for this wonderful opportunity and for the discussions this afternoon. My name is it's Mohammed Suleiman. I'm a fourth-year medical student at the University of KwaZulu-Natal. And my question relates to genomic surveillance in patients with COVID-19 on the African continent. And there has been a theory that those who are immunosuppressed with HIV and AIDS and with other conditions, there's a higher propensity or there's a likelihood that they will develop mutations to the virus. In terms of our genomic surveillance and the samples that we take, to what extent does the evidence in the laboratory support this theory that the emergence of new variants come from those who are immunosuppressed? Because on the African continent, we face this, it's this dual epidemic of HIV and AIDS and TB. And in many countries, HIV and AIDS is it's a major threat to the health system. In the laboratory, to what extent is this theory supported that the COVID-19 variants we are seeing are actually coming from these populations? And then should we prioritize these populations when it comes to services for health emergencies in the future? Thank you so much.
Thank you, Mohammed. I'm going to throw the question open to the panel.
Yeah, thank you so much for that. Very pertinent question. So at our level, we are also a reference laboratory for genomic surveillance. And so far, we have seen all the different strains and subvariants circulating also in our context, but we haven't really gone down to look at the variability in terms of the virus strains as compared to HIV and non-HIV patients. But what we know so far, and it is also what we have been advocating, as the chair mentioned, we are on the national TV each time to talk about this. We know those who are immunosuppressed or immunocompromised stand at high risk of disease severity. But again, the main reason is just that those with poor disease condition, the viral load also is pretty much higher in those contexts. And why? Because the virus keep on replicating. And the viral replication also goes with chances of developing new mutants and new emergent strains. And we also realize in Africa we have a low rate of vaccine coverage. And low rate of vaccine coverage means we keep on having people with free viral circulation. And so it's likely possible that in our African context, we keep on seeing new variants. So new variants for us might be highly controlled if vaccination is also highly covered. And secondly, also, if we make sure those who are infected, like those who have those comorbidities, those who are HIV positive, also get early management. So that's a bit of what we have in our context. I can't say I have a clear answer to your question, but we just believe if we vaccinate people more, if we also protect those who are immunocompromised, we might also minimize the emergence of new variants. Thank you.
Thank you. Anything else from the panel?
From my country perspective, we are doing genomic surveillance, but we are not doing to the level how the immune suppressed people will will stimulate the mutation of the virus. But from theoretically, we know that whenever viruses are having a lot of pressure from the immune response, they should have some mechanism to escape that one. So my perspective is the other way around. viruses, they will put mutation or they will produce mutation whenever they face a very strong response from the host. That is, and most of the time mutations will come because of that. That is a perspective I have from theoretical background, but we sequenced it, but we didn't discriminate those patients like HIV patients from the other one. We aimed only what are the type of variants circulating in our country. And according to time, there were a lot of variants, international variants were also common in Ethiopia. That is what we did. Thank you.
Thank you. Thank you, Mohammed. I'm sure you got an answer to your question. Are there any other questions in the audience? You go ahead.
Yeah, good afternoon. Yeah, so I would like to ask the question concerning COVID in the context of Cameroon. What do you think was, the impact of locally developed medicines that, a few people around the country came up with, in the control of COVID? Thank you.
Thank you. I'm going to throw that question to Joseph.
Yes, so I'm lucky I'm a member of our national response team. So we have observed those local medicinal products that were used for COVID-19 management. And so far we have approximately 4 or 5 of them which were approved as alternative therapy for, not as complementary therapy for COVID-19, but for those who are already taking the modern treatment or the conventional treatment. The major tricky issue we have with the local product is the lack of a rigorous scientific evaluation, because none of them have gone through a randomized clinical trial, so it's quite difficult to attribute the treatment response for a patient based on the fact that he has received X or Y therapy. What we know is that most of those products, from a scientific point of view, seems to have some anti-inflammatory properties or antioxidant properties, which might contribute in terms of alleviating the disease severity. Yes, so that's why actually in Cameroon we recommend, if you are a COVID-19 case, moderate or severe, you first of all take the conventional treatment, then you are free to add one of those traditional products as a supplementary, or we call it as an adjuvant to what we have actually in the health system. Thank you.
Thank you, Joseph. I think with this pandemic, we saw people around the world becoming very reactive. And I'm going to throw a question to maybe Tom and to Lawrence. How can companies such as yours probably allow governments, institutions, universities, and the private sector to come together to be prepared rather than reactive for any pandemic that is going to come about? I don't know, Lawrence, do you want to give that a shot?
Let's give Tom.
Tom, sure. Tom, are you still on the call?
I am.
Sure. Did you hear that question?
I did, and it's an interesting one. I think the pandemic, whether it definitely wasn't its intention, but it's brought us closer to that reality, in that working together with ICGB, like NEB's been doing, discussing new regulations. I mean, one of the things that have, I think, slowed us down for a lot of the diagnostics is how to take brand new diagnostics and move them through the regulatory approval processes quicker. The use of EULs in the US, EUAs in the US and EULs by the WHO, certainly getting quicker regulatory approval throughout the world, so that a single company developing a single diagnostic can make a safe, it has to be a safe and effective diagnostic, useful to as many countries as possible. By having that regulatory approval. That is, the tests came out pretty quickly, but getting those regulatory approvals took longer. And so I think that's something that still we need to work on, but is better than it was in the past.
Oh, great. Lawrence, anything to add?
Yeah, I would also sort of say, I think that one of the things that came out of this, which was really, that also helped it move forward quickly and I think is a good lesson for the future, is to also engage with government very early on as well. I think, you know, it's all well and good to develop new technologies. Companies can move forward with it. Researchers can come up with new ideas. But at the end of the day, you have to have buy-in from the various relevant ministries. And so one of the things that we were doing, particularly in this case, was also speaking to the governments at a very early stage about the new technologies and getting their advice on the best places to work and the best labs with which to interact. And so I think that is something that we shouldn't forget, that government bodies have to be involved as well.
Thank you, Lawrence, for that. Are there any more questions from the audience? We're almost at time, so I'd like to finish off with maybe a question posed to Tom and to Lawrence. It might, I don't know how you can respond to this, but we saw during the pandemic that people started to work together, but we didn't really see companies coming together to work on things. So we saw, you know, the universities combining with the pharmaceutical companies, but we didn't really see two of the big pharmaceutical companies coming together, you know, to make one sort of vaccine or to solve a problem. And I think that we need to get to that point. How far off do you think we are of getting to a place where companies come together, the big institutions come together and work? We come against the backdrop of, you know, the previous session was about academics protecting their technologies and protecting their inventions. But I think when it comes to something like a pandemic and solving real-world problems, we need people to come together. And how far are we away of the big pharmaceutical companies coming together to solve these problems and sharing the benefits? Tom, you want to take that first?
Yeah, that's a really good question. I felt like as the pandemic progressed, that the pharmaceutical companies, which we aren't, so I have to be careful. But what I saw with the pharmaceutical companies is they became more open to this idea of working together to help with the pandemic. As we progressed, what I'm seeing is more of the companies trying to defend themselves for therapeutics, maybe not for vaccines. So I think where there's an opportunity is for, again, governments, academics, industries to come together to figure out a plan for another pandemic, or maybe, clearly this one, but there'll be more, where they can more quickly work together, and they need a framework. Again, it's like the regulatory frameworks that I mentioned before. They just need a framework so that their systems can then quickly adopt a proactive stance. They are not doing that with the therapeutics so much, but that's their bread and butter. So I don't know if they're going to come together on therapeutics. But with vaccines, I think we have an opportunity to continue to work with them, but we need to push that forward now before it's kind of an out of sight, out of mind situation.
Oh, great. Thank you, Tom. Lawrence?
I don't have it. Mary Celine is actually online now, so maybe we could get her.
Sure. I see that Maricel's online now, and maybe we can use the last part of the session to hear what Maricel and Baba from Nigeria has to say about their invention. Maricel, are you able to join us via Zoom?
Yes.
Perfect.
Thank you very much. I'm sorry that I'm joining very late, but it's better being late than never.
Great. Thank you.
Yes.
Welcome. Give us your presentation.
Can I ask them to the secretariat to? All right. Let me try from here. I'm coming. All right. I think I need to be on the slide. I don't know whether slideshow.
Yep.
Yeah. All right. All right. Just the Nigerian experience with the colorimetric RT lamp for the identification of COVID-19. On the next slide. Globally, we all know, so I don't want to go into global impacts. Let me talk about Nigeria. We've had excess of 250 cases and over 3,000 deaths. And incidentally, what wasn't Nigeria's experience was because at the same time of the peak of COVID-19, we had cholera and Lassa fever running concurrently. So, and in Nigeria, primarily we use the RT-PCR with advantages as well as disadvantages. Then we were privileged to be introduced to LAMP kits, which in my opinion, personal experience as a professional virologist, LAMP kit is very, 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 very useful and of advantage compared to RT-PCR in some ways. But there are some other ways in terms of sensitivity that RT-PCR we can say is better off than LAMP. But what I like LAMP for is mainly because it's molecular based, number one, detecting acute infection. It's rapid within 1 hour from the time of sample preparation to reading the result. It's just easy. It has high specificity of 99%. So very high sensitivity, may not be comparable to RT-PCR, not as high, but it's enough to pick the real true positive. It's easy to handle, and it does not require skilled labor. It's not expensive, especially with NEB. It's not expensive. It doesn't require sophisticated equipment like BLS. It's suitable for very, very remote communities. Like I said, the sensitivity might not be as high, but it's up to 79, and it could be used for emergency cases like where you need to know the result before burial because of the way we handle burial ceremonies here. So currently in Nigeria, we are using LAMP to test the saliva samples. And you know, with the sensitivity and specificity of LAMP on saliva, if it would be much preferred to using nasopharyngeal swab or even aspirates. So the saliva project is still ongoing. These are variants that are common in Nigeria, just like in other places. I don't want to go into it because of time. So what are the challenges? The challenges we have, I term it could be field, and on the field example, the samples coming with insufficient quantity of VTM. Or sometimes swab will come without VTM at all. Or you have improper recapping, allowing sample to leak and contaminating and spreading around. And sometimes they come with improper labeling of containers. Or sometimes even the CIA form is not complete, so it's not completely filled. Then we have poor sample collection. Then you test such, it's positive today, tomorrow is negative. You test another day because it was not properly collected. Then you have capacity-related challenges, and they include human resource. You have unqualified, unskilled labor, human resources handling the testing and then giving conflicting results. It could be infrastructure where you have the lab is not properly built to contain to meet the containment requirements of COVID-19. Then it can even lead to an outbreak. Then you have where you don't have a proper equipment like biosafety cabinet level 2. There was a place where I was given a fume cupboard for samples to be extracted, to be used for extraction for COVID-19. It was not correct. Then it could be the kits, the test kits related challenges. Generally, there is shortage of global supply. Or it could be where you have different kits with different sensitivity and specificity. It will give conflicting results. It could be test kits with different targets. This one is only targeting S or N gene. Another one is targeting 3. Or sometimes the extraction kits we use also affects the kind of result we produce. Sometimes this supply of these reagents are extremely irregular. Then we have the test performance challenges themselves. Sometimes there is contamination, like in our own case, we had contamination. Or it could be indeterminate cases. You repeat 2 times, it's still indeterminate. So you have to leave it as indeterminate. Then lack of adherence to test algorithm, which I can link it to unskilled or unqualified labor participating in the testing. Then you have unnecessary repeat. You repeat is inconclusive. Repeat is, there is no need to continue. Then delayed results, because the results are not released on time for use to meet the required outcome. Then it could be inability to pick IC. If you can't pick the internal quality control, then you will say, oh, this result is not valid. Then sometimes you have irregular evaluation of test kits. Yes, when it's not regularly evaluated, then that test kit may not even give the correct result. Then you have manual extraction, where the labor, the workload is very heavy, and when people work under stress, they are bound to make mistakes. Then you have inadequate supervision by the expert in some cases. These are the few. Then just for me, before I will say bye-bye, I normally like asking the question, is COVID-19 a blessing or a curse? And in my opinion, this is my personal opinion, you may have your own opinion and you are entitled to it. In my opinion, it's a blessing and a curse. A blessing in the sense that if there is any infectious disease that attracted political commitment in the history of health system development in Nigeria, it was COVID-19. And COVID-19 now made NCDC, that's Nigeria Center for Disease Control, to be up and doing. How? It helped us to establish infectious disease treatment centers. It also helped. It also helped in the establishment. Right now we have over 56 molecular laboratories that are well equipped to handle any infectious disease in the country. It helps in the creation of public health emergency operation centers. And also it helps the country to provide equipment for critical care in hospitals. Such cares include dialysis machines and so on. Now over 4,000 health workers have been trained on infection prevention control. Right now in the country, in the whole, the 37 states in Nigeria, we have completed the digitalization of the country's infectious disease surveillance system. Now we also have many vehicles that have been provided to support outbreak investigation in the 37 states of Nigeria. And we now have ensured regular supplies of treatment and testing supplies, among other activities in the country. So the cause, we have over 3,000 dates. These dates, some were parents, some were breadwinners, with repercussion. Some were even adults that the parents were looking up to as their investment for future. They are all gone. So in my opinion, I will say COVID-19 pandemic has helped us to know that keeping the virus in hell where it actually belongs to requires what? National, regional, global collaboration and vaccination for all, so that the virus will be in hellfire where it's supposed to be and not among human beings. So this is my brief presentation. Thank you very much.
Thank you, Maricel. And I think, COVID-19 has been devastating throughout the world. But one positive aspect of COVID-19, it helped bring the world together. And it also brought things like Zoom, where people can actually be 10,000 miles away, but make it seem as if we're all in a room together. So I think those are the long-lasting effects.
Yeah, you're right. You're correct. Thank you very much. Thank you.
So, you got a question?
Yeah. Thank you very much.
Sure. One last question.
Yes, thank you very much, Chair. I'm not sure if I'm observing well through the talks. I'll try at a higher pitch. I'm not sure if I'm observing well through the talks. I see the COVID numbers from African countries being much more lower than the numbers we saw in South Africa. What factors could attribute to those numbers? And I think from the last presentation, I see that the deaths, just COVID deaths in Nigeria account for about 3,000 lives, whereas in South Africa, the number is quite scary even to mention. So how does this discrepancy can be explained?
Maraselin, did you hear that? Do you want to tackle that from where you are?
I'm sorry, I didn't get the question. Please, it was the connectivity.
If I can reiterate the question. So the question is that the numbers of COVID-19 deaths in other African countries weren't as high as those in South Africa. Can you explain that?
I cannot explain why, the differences in the number of deaths. I cannot explain. The reason is that the resistance of individuals in different environments to the fatal effect of the disease differ.
Right.
They differ. So there's no how I can explain why we have more deaths here, though we are all Africans. And we have to think about the food, we have to talk about the environment, and so many other genetical factors that may be involved.
Right. Eric, you haven't spoken. Do you want to offer sort of an explanation for that?
I can just offer a suggestion. Actually, that is one question that has been disturbing the scientific community for a long time, because we still do not have an answer for that. But there are studies that are underway that are trying to tease apart what is going on in the background. Like Professor Maslin is saying, there are a variety of factors that can be attributed to that. But at the moment, we have not nailed it down, but we are going to do that.
Thank you, Eric. I think we're almost at the end of our session, but I'm going to ask each of our panel to make some closing remarks, and I think I'm going to start from my extreme left and work my way on. So Eric, I don't know if you want to start making some very brief closing remarks.
My closing remarks will be that from this pandemic, what we have learned is that the world has to work as a team. Diseases do not have boundaries. So a disease that is affecting somebody in China will quickly come to your country. So I appreciate the collaboration that we've had with ICJEB and the donations from NIB. And that is the way to go to contain future pandemics.
Thank you, Eric. Moleleni?
Thank you. As Dr. Eric told, pandemics are nowadays, they are international, happen somewhere. It will happen anywhere also. So we have to collaborate. We appreciate the collaboration we are getting from ICGB, especially my lab utilized a lot working with scientists at ICGB, and I would like to appreciate this the North-South collaboration or South-South collaboration. Thank you very much.
Thank you. Joseph.
Yes, thank you very much. Also, I join my voice to my peers to really praise the quality of collaboration we have seen with this project, mostly the South-South collaboration, which has been highly strengthened. We also see local scientists discussing their issues now together, trying to get African solutions to African problems. For example, the last question we just have about mortality, we believe also that in addition to what has been said, in several African countries, we have a very low rate of testing coverage. So South Africa, for example, where they have advances in molecular biology, it is normal for them to also have a high number of cases reported, a high number of COVID-19 related mortality, which might not be the case in other African countries. And we believe RT-LAMP really stands as a good tool to reduce the gap that we have been seeing in these countries and also to improve future pandemic controls. Thank you.
Thank you, Joseph. I'm going to come back to Tom and Lawrence. I'm going to go to Maraselin first. So Maraselin, if you're still on the call, any closing remarks?
Yeah, I want to really use this opportunity to thank ICGEB and NEB, because they were not just satisfied with their empowerment, and the inadequacy of Africa. They recognize our inadequacies and scoop down to say, Lord, let's help these people out. So without them, in fact, like in my lab, we would have been behind schedule. We wouldn't even have been able to achieve what we have gotten so far. And I pray that other developed countries will emulate Italy and ICGB and MEB for collaborating with us, because in my opinion, controlling epidemics, pandemics, endemics, if it's limited to only a particular country, irrespective of where it is located, it will be just like eating a half-baked cake. Therefore, that collaboration at national, regional, and global is what we need to keep these microorganisms that are being a torment, a havoc to our lives where it ought to be. Thank you very much.
Thank you, Mary Selin. Tom, are you still with us?
Yes, I am.
Perfect. Any closing remarks on your side?
Yeah, I'd just like to say first, thank you. It's been mutually beneficial collaboration between ICGB, NEB, and the clinical labs in the 5 African countries. I've learned so much and have appreciated their contributions. What is interesting to me about all of this is the fact that technologies that have been developing for years all of a sudden are real, and how we make best use of those technologies. Not only the RNA vaccines, which give us a great potential to more rapidly deal with problems in the future, or diseases in the future, but also diagnostics. And not only for a pandemic, but I really think we now have the confidence in the technologies to make diagnostics that are specific to local problems, and that will have a big impact on the healthcare of people into the future. So it's an exciting time moving forward.
Great. Thank you, Tom. Lawrence, closing remarks.
I'd just really like to thank everybody who we've been collaborating with through this project. I've been DG of ICGB for 3 years, and this is just the sort of activity that we really want to be involved in and do more of. And really, with the team, it's been a real joy to work with everybody. And I think we should also say a massive thank you in particular to Tom Evans and NEB, which have really been so generous with their support and their help throughout the whole process. And, you know, one of the issues that I think everybody has mentioned is, you know, supply chains and getting reagents moved around the world during the pandemic was really quite a challenge. But the guys in Boston were just fantastic, and so really the whole team, it's been great, and I'm really looking forward to continuing the collaborations. It's really very, very exciting and very, very enjoyable, and thanks to everyone, and thank you to all of you this afternoon for being here.
Thank you, Lawrence. And I think, you know, to close, if there's one thing we can take away from this session is that working together, we can actually go much further than we can working alone. So to leave you with that, I wish you a good evening, and thank you for joining this session.
Thank you.
Thank you.
Thank you. Thank you. Thank you. Thank you from Nigeria.
Cheers. Bye-bye, Mary Selin.
Bye-bye.
Bye.
Yeah.
Bye-bye.
Dr. Banks, it's good to see you again. I'm seeing my friends.